Okay, the recording has started. Thank you, everyone, for joining us today. We appreciate you making time on this Tuesday morning. Several items to update you today, so thank you for taking a few minutes to be with us. Our primary focus, though, of this call is an educational update. So I've heard from several local businesses who have inquired about the status on school reopening. Will they be in person? Will they be virtual? Will they be both? What's going on under the guise of either, they have kids in the districts or maybe they have employees that have kids in the district. So that definitely has an impact on our local businesses. And governments and really everything else in the community. It's really, I think we all know, a very, very top issue right now we're facing. And we're very grateful to have the superintendent of the Shiawassee Regional Education Service District, Dave Schulte, join us today to sort of give you a what's latest in terms of all of that. And I just want to say thank you to Dave, to Lena from the RESD, who is a shared team member, and his whole team, who do an awesome job coordinating educational activities, implementing educational activities on a county level, working with all the local school districts. It's a tremendous organization doing great work every day, pre-virus, currently, in the future, to help educate our kids and take care of them. So we very much appreciate all the work that the Shiawassee RESD does to help. We appreciate the partnership that we have had with them over the last many years, and very, very grateful for all the work they're doing right now to try to navigate these waters. I've told Dave and I've told many of my educator friends, we know it's tough times for everybody, but the challenges that they're facing are really, really tough. So I have great respect for Dave, his team, all my educator friends, and we're obviously here to help them in any way we can. But all that being said, wanted to have Dave on the line today to give you that sort of what's latest, what's happening. Things are changing rapidly, but wanted to at least give you that perspective about what's going on. So with that long lead in, I'd like to turn it over to Dave Schulte from the RESD, and he will give you an update. Dave?
Thanks, Justin. I appreciate that. I would like to stop there after that great endorsement. So anyways, good morning, everyone. I will give you an update this morning on where we're at as an overall group. I'm not going to talk specific district plans because every district's in a little bit bigger spot. So, this is a massive undertaking for us. The roadmap that was produced by the governor was not provided till the end of June, which I know that seems like a long time ago for schools, but at that point, that's very little time for us to get ready for the start of school. So we've been working a very difficult situation, but also really hard over the summer to be responsive to the community needs, staff needs, and most importantly, student needs. So I'm going to put an asterisk on this entire conversation and that this is what I know as of this day and time. And the situation is that fluid that sometimes within the same day we get information that changes our plans. So this is the best I can tell you as of right now. And moving forward, my suggestion is to touch base with your local school district if you have questions about their specific plan. So at this stage of the game, all districts in the county currently are planning to offer at least face-to-face and online options for students. Some districts are looking at hybrid solutions, which are a combination of face-to-face with some virtual components. That is still being finalized, and those plans are due to the intermediate school district, which is who we are, on the 15th. By the 15th of August, we are not evaluating the plans, but we are to then take and upload all the plans, including our own, to the state on August 17th. These are living documents, and I no longer say they will probably change. They will change, and changes occurred in districts even over the weekend and last night still. So doing the best that we can in a situation. Um, the decision for face-to-face certainly is an attempt to provide what the service that the community wants, while being cognizant of the fact that, like all of you, we are employers as well, and we have employees, and just like your employees have concerns, our employees have concerns about health and safety and how things are going to work. So our plans really revolve around three unique situations. If the governor puts us into phase 1 through 3, anywhere in that, we will be going to fully online learning. That's required under the roadmap that was produced. So if we move back to phase 3, we will be at 100% online. In-person school will not be allowed. Phase 4, which is what we in much of the state in the lower part are in, requires us to produce a plan that allows for some face-to-face instruction with some very tight requirements, as well as a set of strong recommendations as well. So districts are working to develop that portion of their plans and finish it up. And this phase 4 covers everything from face coverings, hygiene, spacing, cleaning, screening of students and staff, the curriculum options, being how we're going to handle and respond to tests, whether they're positive tests, testing protocols in the end, and how we're going to move forward on that. So there's a substantial amount. We have to include how we're going to deal with medically vulnerable students, obviously busing, student transportation, food service, the mental and social, emotional health of our students, athletics. So there's a lot that goes into this plan. At the same time, trying to fit this all within a budget that was not designed to offer multiple learning styles. And I will share a stat that's been widely publicized, and I think it's a conservative number in reality as we have moved down the path of just the additional cost of personal protective equipment for staff and students in the state could eclipse $1 billion in the school portion of the community. So it's an interesting process we're going through because the state is on a fiscal year that's October to September 30th, where schools' fiscal years are July to June 30th. So we technically are in our new budget year, but we do not have a budget for next school year yet from the state. And we're being told, based on obviously the difficult economic situation we were going through, to expect a reduction in funding at a time when we are looking at having to increase funding substantially. I think the other issue that we continue to struggle with and are working on is the technology and internet access portion of our county, and we have around an average around 30% of students don't either have access to internet at home or a device. I don't know that that's too far out of line with other parts of the state that is very close to where near the state average is, between 25 and 30%. So online learning brings some additional complications in those cases where we don't have an opportunity to provide a devices which are in a short supply. In fact, an extreme short supply in many cases. So the upside is we've had some great partners in our staff, our administrators, our parents, our students. The health department has been a very great partner working with us since this all began and before, to be honest with you. We are collaborating and talking to each other on a frequent basis. And we're actually using a toolkit that was published by the Shiawassee County Health Department, specifically focused on schools, and administrator toolkit. So they've done a great job. And shout out to Larry Johnson and Dr. Trinan both, who have met with superintendents many times to make sure that we have what we need. There is another portion of this plan that we are to develop, which is for phase 5, which is where most of the Upper Peninsula and part of the lower is, and that's where regulations are a little bit more relaxed as far as requirements. So we have to have a plan in our document for that as well. And of course, phase 6 is back to whatever the new normal is. So we're right now working on finishing those up, working with our partners, trying to get information that we need to have, and then trying to forecast the financial impact of that decision. So we are looking and hoping for some flexibility from the legislature. There's some bills pending, but unfortunately, due to the fact that they had a positive COVID test, they've been out. So we're hoping that Saturday and Monday we are able to see some flexibility in how we offer instruction to families and students. So, like I said, we're working hard on putting as much detail as we can into these plans, knowing that it changes. Everybody is planning to offer at this point in time face-to-face as well as online options, and many districts have a hybrid in between those two. And we're trying to continue to work our way down the roadmap, again taking into account that like all of you, we're an employer as well, and we need to work with our employees on the plan that we put forth. So I'd be glad to answer questions from folks. I apologize right up front. There'll probably be some I don't knows. Seems like that's all the answers we have in many cases. So.
Dave, thank you. Once again, I appreciate all the hard work you're doing, and I think the key thing is to emphasize patience. We know you're trying to deal with a lot of changes every day, so patience, I think, is critical on everyone's part. I would like to open it up. If anyone on the call has any comments or questions for Dave, please hit *6 on your phone, *6. Anybody have anything for Dave? Well, Dave, I think you might have covered everything.
I appreciate it, and I appreciate the comment about patience. I think that's the biggest thing we're going to need is folks to just bear with us. We're doing the best that we can, and certainly committed to finding the best solution.
Yep, and as you said, obviously, they should, obviously stay in touch with their local district. Is there anything else, though? Any other things to note for employers on the phone, Dave, you wanted to be thinking about during this time with their employees?
I think that everybody has to understand is we're not making the choice. Families are making the choice of how they are going to move forward with education during the pandemic. So I'm hoping the recognition can be that it's not a decision we're making. If a family decides to go online or chooses face-to-face, whatever they choose, that really is a family discussion, and we recognize the need for students to be back in school as much as possible, and balancing that against the community needs as well. So we are cognizant of that fact. We agree to the extent that it's humanly possible and safe. That's what everybody wants. But again, recognizing that this decision is being made by individual families. So there are many families that are still trying to decide what they want to do.
And I just want to say, I talk with Dave and the RESD team regularly. I'm in touch with them, getting updates. So as this goes forward, I will stay in touch with Dave and be able to pass along any relevant information to the businesses on the call. Anybody else, last chance, anyone have any comments or questions for Dave or schools, anything like that? Hit *6 on your phone. Anybody have anything? Okay, well, Dave, thank you for taking some time to jump on today. Once again, appreciate the great work, the hard work that you and your team and all of our educators are undertaking, and please know you have our support and the support of the Shiawassee County business community.
Well, thank you, Justin. We appreciate that, and we look forward to continued partnership.
Very good. Well, thanks, Dave. Feel free to jump off, or you can stay on. I do have a second guest speaker today that I invited to join us, Becky Dawkey from Memorial Healthcare. Memorial has just instituted a new program. It's called Community Conversations, a great way for them to keep you informed about what they're working on, but also to be able to take comments and questions from you that they hopefully can answer. As you all know, we've had the CEO Brian Long on before talking about what Memorial is working on, but this is a new program they're doing that I think is really beneficial, educational. We obviously greatly value Memorial and the partnership we have with them. We're very, very lucky to have such a tremendous community hospital based right here in Owasso and Shiawassee County. So I wanted to have Becky come on to talk about their new Community Conversations program, and then also, be able to say how you can get involved in participating in that program. So Becky, I will turn it over to you.
All right. Well, good morning, everyone, and thank you for having me on, Justin. As he said, my name is Becky Dahlke, and I am the Community Resource Manager at Memorial Healthcare. My role serves not only as an ambassador for Memorial Healthcare out in the community, but also as a liaison for bringing identified community needs back to the hospital. And of course, the biggest topic for most people right now is COVID-19. And there's so much information out there regarding the virus, but unfortunately, not all of it is accurate. And we want to be your community healthcare expert, your go-to source for information on COVID. So we've started this weekly video update that we are calling Community Conversations to offer our patients and the community up-to-date information about topics such as testing, how to help prevent the spread of COVID, what to do if you think you've been exposed, and telemedicine. So we want to invite the community to submit their COVID-19 related questions on our website. They can go to www.memorialhealthcare.org and click on the red COVID-19 banner at the top. That will take them right to a form that will allow them to share their question with us, and then we can have one of our experts answer it for them. And it could be either on our video broadcast, or we might be start doing more of those FAQ messages to send out to the community. The videos are going to be released every Thursday on Memorial Healthcare's YouTube channel, and then we'll also put links on Facebook, Twitter, and Instagram. So this last week, we featured Megan Smith, the Associate Vice President of Quality and Safety at Memorial, and also Kevin Davis, the Associate Vice President of Operations. They shared information on testing and also about what Memorial is doing to keep our patients, visitors, and staff safe. This week, we're going to be having Dr. Hassan Nasir from Memorial Healthcare Allergy and Immunology, and also Nick Decker, Director of our labs. And they're going to be talking about what tests are offered at Memorial and what they involve, the process of being tested, how you get your results. So again, we really want to encourage anybody that has a COVID-related question to submit those through our website. It not only helps us find out what information we need, but gives us an idea of, what is the growing concern out in the community, what they need to know about. And then watch for Memorial's next community conversation video this coming Thursday. And again, if you have any questions, if anybody has questions, they can always contact me. My email is rdahlke@memorialhealthcare.org. And my phone number is 989-729-4856. Again, I'm the liaison between the community and the hospital. So if you have concerns, thoughts, insights, I'm more than happy to hear those thoughts.
Very good. Thank you, Becky. And I did send out an email. You should have got it last week with more information on the program too. So once again, I want to thank Becky. I want to thank the whole Memorial team. We are extremely grateful to have this incredible healthcare resource in our community, helping us not only through COVID-19, but all the great work that they do, year round. And I think a lot of you know this, maybe you don't. My mother has actually worked there for 46 plus years too. So it definitely holds a near and dear place in my heart. So thank you, Becky, and definitely check out Community conversations. A couple of other items I wanted to hit on today. Actually, tomorrow, you've seen several invitations from me. We are having our annual meeting tomorrow afternoon, 2 p.m. It's going to be at the Mitchell Ball Fields Park Pavilion in Corunna. And I mention that because I've had a few people say McCurdy Park. Now, there is a pavilion in McCurdy Park, the big park, but that's not the one. It's across the river in the softball fields over there. So you're welcome to join us. We're going to be outside under a pavilion. We have plenty of seating, plenty of distance for folks. We do ask that you bring and wear a mask to be safe. We're going to have a networking segment, and then we're going to have a program. It's going to be about a half hour. It's mostly going to be videos, as we normally do. We work with Michael Jordan from David Lauren Photographic, and we've put together a couple of videos this year that we are really excited to show all of you. One video is focused on what we've done to help businesses through COVID-19. The other video is sort of a look forward type, video in terms of businesses that are growing throughout the crisis. So really excited to show that. If you're not able to attend but would still like to participate, we are offering a virtual option. So you should have seen that in the email I sent out yesterday. There is a Microsoft Teams link. You can join that. There'll be a live feed starting at 2 o'clock. The program will start at 2:30 tomorrow. So please join us if you're interested. Actually, also tomorrow, if you're interested, we are doing another groundbreaking. So some of you have seen we've been doing groundbreakings lately. This is our third one in the last couple of weeks. This one is going to be at 4 o'clock, supporting Sheridan Auction Service and Crow Real Estate. They are putting on a building addition in Owasso. It is on the south side of town, right on Washington Street at the bottom of Ute Hill, right there by Baker College. So anyone is welcome to attend that. It's very exciting, obviously, to break out those ceremonial shovels and do more groundbreakings for more new construction. I do want to give everybody an update on the small business grants. I've had a few messages already this morning on that Michigan Economic Development Corporation Small Business Restart Grant. Application window closed last Wednesday. It is in the evaluation process right now. I would anticipate probably having an update sometime in the next week or two. So stay tuned on that. If you have put in an application, you will be notified of an update here probably in the next week or two. The hope being this gets turned around pretty quickly. I am going to send out a note today, another resource for trying to attract talent. One of our media partners, Town Square Media, is offering a virtual job fair for those employers on the phone that are hiring. So look for an email in your inbox probably later today on that. As we all know, talent is the top issue right now. And I do want to reiterate, and I'm going to send out an email on this as well. We had a guy on the call last week. His name is Mark Rideout. Long story short, the SBDC office, which has been awesome during this whole crisis, Janice Mueller, Cheryl Peterson, they got some federal money to hire consultants to basically provide free consulting that would cost businesses a good chunk of money. You get it for free. Well, we got a guy through that. His name's Mark Rideout. He's an HR expert, and he is ready to jump in and help companies in Shiawassee County that are having challenges with talent recruitment, talent retention, things like that. So we want to make that resource available to all of our companies in Shiawassee that have issues with talent right now. So I'm going to send out a note on that here later today if you want to get engaged with Mark on that. And then as always, if anyone is hiring, please do let us know. I'm getting a lot of job postings, people emailing me, texting me, social media. So please let us know. We want to be able to share that ourselves and share it with our workforce development partners. And then lastly, and once again, thank you to Memorial. They do offer testing. So we do want to continue to note if anyone needs testing for the virus, they can help you out with that, both virus and antibody and PPE. We do have a database. We've talked about it a lot over the last few months. We have a spreadsheet of 20 different companies that offer PPE products and services. Next week, we're going to have a new provider on, pretty interesting, local business offering videos that you can show to your employees on COVID-19 to help with safety protocols. So we'll have that next week on our call. So that's everything I have today. It's 9:30 already. I want to be respectful of everyone's time. I don't have anything else to cover. Does anyone have any comments or questions for me right now? If you do, hit *6 on your phone. Any comments or questions? Okay, well, thanks everybody as always. Appreciate you making time on this Tuesday. If anything comes up, give me a holler. Thanks.